SLP Sanjay Kumar, voice therapist, and today date is 1st August 2024, and we are before treatment live. I'll be showing the patient who has come from different places for their communication disorder treatment. I'm just turning the camera. So these are the patient who has come from different places for communication disorder treatment. Actual number of patients are many more, including international patient, but few are they are not comfortable with the video, so I'll not be able to show to you. तो नमस्कार दोस्तों, आप सभी का स्वागत है हमारे यूट्यूब चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर। और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और आज डेट है 1 अगस्त 2024 और भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे। तो आप लोग जो है हमारे यूट्यूब चैनल को सब्सक्राइब कर लीजिए, बेल आइकन को प्रेस कर लीजिए ताकि जब हम ट्रीटमेंट के बाद लाइव हों तो उसको भी आप लोग देख पाएँ। और इस लाइव में जिन बिंदुओं पर हम चर्चा करेंगे उसको एक एक करके मैं बता देना चाहूँगा। ऑफ कोर्स जो पेशेंट्स आए हैं उनकी वॉइस को तो आप लोग सुनेंगे ही ट्रीटमेंट से पहले कि वॉइस कैसी है। साथ में जो जिन बातों पे हम चर्चा करेंगे वो होगा इंट्रोडक्शन अबाउट मी, पहले होगा मेरा एक संक्षिप्त परिचय होगा स्पेशली फॉर दोज हु आर न्यू एट आवर यूट्यूब चैनल, एंड देन आई विल बी टॉकिंग ऑन our center. The next will be our YouTube channel, and then you'll be listening patient's voice before treatment who has, and today date is 1st August 2024, and then next will be what are the information required before starting speech therapy. तो स्पीच थेरेपी स्टार्ट करने से पहले किन बातों के बारे में जानकारी जुटानी चाहिए. Then I'll be talking on kind of service we provide at our center. Next will be high pitch voice sign symptom cause and treatment. Then I'll be talking on vocal cord paralysis, sign, symptom, cause and treatment. Next will be stammering, sign, symptom, cause and treatment. Then I'll be talking on is there any side effect of voice therapy or self-treatment. Then I'll be talking on how to contact us. Next will be what we do in voice therapy. So do we have accommodation facilities at our center? Which treatment is preferred first? Voice therapy or surgery for pitch correction? And next will be, do we have any branch of our center? After that I'll be talking on cost and duration of the treatment for voice and speech disorder. Next will be how do we treat international patient, online or offline. Next will be is saying 1 2 3 or saying in new voice is the stage of treatment or the end of the treatment. And the next will be is voice therapy result is permanent. Next will be effect of food and drink on voice, and there will be announcement of next batch of group therapy. So that I'm doing now only. Our next batch of group therapy is going to be started on 22nd August 2024, and then I'll be talking on who are the good candidate for voice therapy for our center. Next will be is all high pitch voice or female voice is puberphonia. Next will be online facilities for communication disorder at our center. Then I'll be giving few tips to keep your voice healthy. Either you have the voice problem or you don't have the voice problem. How to keep your voice healthy? I'll be giving few tips. So please be connected with us. And next we'll be replying to the question from the live chats. So please be connected with us. तो एक एक करके आगे बढ़ते हैं. फर्स्ट इज इंट्रोडक्शन अबाउट मी. तो माय नेम इज संजय कुमार. यू कैन से SLP संजय कुमार. SLP मीन्स स्पीच लैंग्वेज पैथोलॉजिस्ट. So by profession I am a speech language pathologist, and I have studied from AIIMS Delhi, from All India Institute of Medical Science. I did my Bachelor of Science honors in speech and hearing, and I did my master from University of Mysore, and my master degree name is Master of Science in Speech Language Pathology. And of course I'm an audiologist, so we do hearing testing at our center, hearing aid dispensing, hearing aid fitting apart from the voice therapy, and my passion is treating voice disorder. So this is small introduction about me, and our center name is Sanjay Speech Hearing and Rehabilitation Center. If you can see the here Sanjay Speech Hearing and Rehabilitation Center. If you do the Google search you can find easily where it is, and it is located in Bangalore. You can find in the Google map also. And we started our center in the year 2010. So from last 14 years we are treating voice disorder and we are creating hope across the globe. सो वी आर स्पेशलाइज इन नॉन सर्जिकल मैनेजमेंट ऑफ वॉइस डिसऑर्डर. सो बिना सर्जरी का, बिना मेडिसिन का हम वॉइस का ट्रीटमेंट करते हैं. और टू नो अबाउट द व्हाट काइंड ऑफ ट्रीटमेंट वी डू इन मोर डिटेल, यू कैन एक्सप्लोर आवर यूट्यूब चैनल, एंड दैट आवर यूट्यूब चैनल नेम इज SLP Sanjay Kumar Voice Therapist. आई एम जस्ट टर्निंग द कैमरा so you can know more about our YouTube channel. So this is our YouTube channel, and so we started our YouTube channel in the year 2010, and we started uploading before treatment, after treatment video, and that started giving hope to the people those are more interested in non-surgical management. Without surgery, they wanted to manage their voice disorders. Our client list include people across the ग्लोब. तो दुनिया का कोई भी ऐसा महादेश छूटा नहीं है जहाँ से लोग ट्रीटमेंट नहीं लिए हों. अभी आप देख रहे होंगे इसमें एक पिक्चर दिख रहा होगा, एक फादर है और एक बच्चा है. तो जो उसके फादर हैं वो US के हैं, और उनका इनफैक्ट वो र्यूमेटोलॉजिस्ट हैं, मतलब वो भी डॉक्टर हैं. उस बच्चे की मम्मी भी डॉक्टर है और USA के हॉस्पिटल में काम करते हैं, फिर भी हमसे ऑनलाइन ट्रीटमेंट लिया. तो कहने का मतलब हमारे काम की पहुँच कहाँ तक है, इससे आपको पता चलेगा अगर हमारे इस वीडियोज़ वगैरह को एक्सप्लोर करेंगे. तो ये रहा हमारा यूट्यूब चैनल का संक्षिप्त परिचय. और भी ज़्यादा डिटेल में आप जानना चाहते हैं तो यू कैन एक्सप्लोर आवर यूट्यूब चैनल प्लेलिस्ट. यू विल फाइंड डिफरेंट कम्युनिकेशन डिसऑर्डर प्लेलिस्ट, एंड दैट ईच एंड एवरी प्लेलिस्ट विल बी हैविंग बिफोर एंड आफ्टर ट्रीटमेंट videos of that particular patients, and that will give an idea how much change it happened for that particular patient, what was the duration. So you'll find all the different kind of. So my suggestion is please explore our YouTube channel playlist. Once you explore our YouTube channel playlist, you'll find a playlist of vocal cord paralysis, Puberphonia, high pitch voice, sulcus vocalis, phonatory gap, functional aphonia, functional dysphonia, aphasia, misarticulation, hearing aid dispensing patients, after hearing aid dispensing, how the communication improved, those kind of patient. So my suggestion is just explore our YouTube channel playlist, understand our work in more detail. So this is our YouTube channel, and that also we started in the year 2010. So last 14 years we are non-stop uploading the videos before and after treatment success stories and creating hope across the globe. People having different voice disorder, for them it is giving hope. And next is you will be listening to a patient's voice before treatment. तो patient की voice before treatment सुनने से पहले मैं एक और क्वेश्चन पे बात करना चाहूँगा. व्हाट आर द इन्फॉर्मेशन रिक्वायर्ड बिफोर स्टार्टिंग स्पीच थेरेपी. तो स्पीच थेरेपी स्टार्ट करने से पहले किन बातों के बारे में जानकारी जुटानी चाहिए, ये कि बहुत ही इम्पॉर्टेंट है. कई बार हमारे पास पेशेंट आते हैं जो या तो सेल्फ ट्रीटमेंट के शिकार होते हैं या झोला छाप किस्म के व्यक्तियों से ट्रीटमेंट का शिकार होते हैं और अपनी वॉइस वोकल कॉर्ड को डैमेज कर लेते हैं. तो कैसे वॉइस और वोकल कॉर्ड को डैमेज करते हैं. मान लीजिए एक प्यूबरफोनिया का पेशेंट है और वो रॉन्ग वोकल एक्सरसाइज या रॉन्ग तरीके से राइट वोकल एक्सरसाइज ही किया लंबे समय तक, तो उसको फोनेटरी गैप डेवलप हो जाता है, सल्कस वोकलिस डेवलप हो जाती है, कई बार वोकल नोड्यूल डेवलप हो जाता है वोकल अब्यूज़ की वजह से. तो आपकी वॉइस और वोकल कॉर्ड्स बहुत ही कीमती है. इसको किसी अरे गहरे व्यक्ति के हाथ में दे के स्पॉइल मत कीजिए. जब आपकी बाइक और कार की बात आती है तो आप पेट्रोल पंप ऐसा ढूंढते हैं जहाँ पे अच्छा पेट्रोल मिलता हो. तो आपकी वॉइस और वोकल कॉर्ड को कैसे किसी अनाड़ी के हाथ में दे सकते हैं. तब क्वेश्चन ये उठता है कि हम एक आम इंसान जाने कैसे कौन असली है कौन नकली है. तो जुड़े रहिए, अब मैं उस पर आने वाला हूँ. तो सबसे पहले जब आप स्पीच थेरेपी लेने जा रहे हैं तो इस बात की पता करने की कोशिश कीजिए कि जिनसे आप स्पीच थेरेपी लेने जा रहे हैं उन्होंने अब पढ़ाई कहाँ से किया है. उनकी जो है कॉलेज का नाम, स्पीच एंड कॉलेज या मेडिकल कॉलेज का नाम क्या है. फिर ये पता कीजिए कि उनकी डिग्री क्या है, डिग्री का फुल फॉर्म क्या है. फिर कई बार नकली भी लोग कॉलेज का नाम लिख देंगे, नकली भी डिग्री लिख देंगे. तो आप ये जानने की कोशिश कीजिए कि कौन से ईयर में उन्होंने क्या डिग्री प्राप्त की. ये सारी चीज़ों के पीछे नहा धो के पड़ जाइए. अगर हेल्थ केयर क्वैक्स होगा तो इसका जवाब या तो अपने सोशल मीडिया पेज पे देगा नहीं, और अगर आप पीछे पड़ जाएंगे तो गोलमोल आंसर देगा. मैं आपको एक चीज़ यहाँ पे बताना चाहूँगा कि इंडिया में एज ए स्पीच लैंग्वेज पैथोलॉजिस्ट, ऑडियोलॉजिस्ट, स्पीच थेरेपिस्ट काम करने के लिए मिनिमम आपके पास बैचलर डिग्री होनी चाहिए. यूएसए वगैरह में मिनिमम मास्टर डिग्री होनी चाहिए. इस स्पीच एंड हियरिंग फील्ड में एक डिप्लोमा होता है, DHLS, डिप्लोमा इन हियरिंग एंड लैंग्वेज स्पीच. तो वो 1 साल के आसपास का होता है. तो वो लोग टेक्नीशियन होते हैं, वो स्पीच थेरेपिस्ट ऑडियोलॉजिस्ट नहीं होते हैं. तो आप कंफ्यूज मत होइए टेक्नीशियन में और स्पीच लैंग्वेज पैथोलॉजिस्ट एंड ऑडियोलॉजिस्ट में. तो रिहैबिलिटेशन काउंसिल ऑफ इंडिया एक गवर्नमेंट की ऐसी संस्था है भारत सरकार की जो कि रिहैबिलिटेशन फील्ड में काम करने वाले लोगों का रजिस्ट्रेशन करती है. तो अगर कोई व्यक्ति अगर स्पीच लैंग्वेज पैथोलॉजिस्ट ऑडियोलॉजिस्ट काम कर रहा है तो उसके पास एक RCI द्वारा दिया गया CRR नंबर होगा। स्पेशल एजुकेटर के पास भी RCI CRR नंबर हो सकता है, साइकोलॉजिस्ट के पास भी हो सकता है, स्पीच एंड हियरिंग टेक्नीशियन के पास भी हो सकता है, ईयरमोल टेक्नीशियन के पास भी हो सकता है। तो कहने का मतलब कोई बोल दिया कि मेरे पास RCI CRR नंबर है तो आप ये मत सोच लीजिए कि वो एक स्पीच थेरेपिस्ट एंड ऑडियोलॉजिस्ट है। वह व्यक्ति इस फील्ड में, स्पीच लैंग्वेज पैथोलॉजी फील्ड में, ऑडियोलॉजी फील्ड में रजिस्टर्ड है कि नहीं, ये जानना बहुत ज़रूरी है। अब मैं आपको वो दिखाने जा रहा हूँ स्टेप्स जो कि आपको कभी भी ठगी का शिकार होने से बचाएगा। मैं एक कैमरा टर्न कर रहा हूँ, ये मेरा यूट्यूब चैनल का कम्युनिटी पेज है, तो इस पर मैंने वो डाल के रखा है स्टेप्स। तो पहला स्टेप ये है कि आप इस वेबसाइट पे जाइए, ठीक है। इस वेबसाइट को एक्सप्लोर कीजिए, क्लिक कीजिए, उसके बाद आएगा ऑप्शन सेकंड में CRR नंबर। फिर उसके बाद CRR को क्लिक करेंगे तो ऑप्शन आएगा CRR रजिस्टर्ड, उसमें स्क्रॉल करेंगे तो फिर उसके बाद क्लिक करना है सर्च बाय CRR नंबर, फिर उसके बाद एंटर CRR नंबर। जैसे ही CRR नंबर डालेंगे, अब कहेंगे CRR नंबर कहाँ से लाऊंगा। जब कोई अगर अपना CRR नंबर नहीं बताता है और बोलता है कि मैं रिहेबिलिटेशन में काम करने वाला प्रोफेशनल हूँ, तो अपने आप में ही यह सिम्टम है कि वो एक झोला छाप किस्म का व्यक्ति है। तो अगर आपको मेरे CRR नंबर जानने की उत्सुकता है तो इस वीडियो के डिस्क्रिप्शन में जाएंगे तो मिल जाएगा। तो कहने का मतलब CRR नंबर आपको पता होना चाहिए अगर आप सर्विसेज लेने जा रहे हैं। तो अगर आप CRR नंबर जैसे ही डालेंगे सारे स्टेप्स के बाद, जैसे ही सबमिट करेंगे तो आपको इन्फॉर्मेशन मिलेगा रजिस्ट्रेशन स्टेटस, क्वालिफिकेशन और रजिस्टर्ड एज। ये बहुत ही इंपॉर्टेंट है, रजिस्टर्ड एज। अब कोई व्यक्ति स्पेशल एजुकेटर की तरह रजिस्टर्ड है, पढ़ाई किया है स्पेशल एजुकेटर में, एजुकेशन में, या साइकोलॉजिस्ट के रूप में रजिस्टर्ड है, अगर वो स्पीच थेरेपी ऑडियोलॉजी के काम कर रहा है या अपने आप को बता रहा है, तो आप खुद समझ सकते हैं कि ये एक झोला छाप की इंसानी है या नहीं है। तो जो व्यक्ति जिस रूप में रजिस्टर्ड है उसी के रूप में अगर काम करे तो हम कह सकते हैं कि वो एक प्रोफेशनल है। अगर वो दूसरे फील्ड में हाथ पांव मार रहा है तो बेरोजगारी का शिकार और वो एक झोला छाप किस्म का व्यक्ति हो सकता है। तो इन सारी चीज़ों को खंगाल के अगर आप ट्रीटमेंट लेंगे तो आप ठगी का शिकार नहीं होंगे। और अब आप हियरिंग एड अगर आप लगाते हैं, किसी पेशेंट को सुनाई की टेस्टिंग करवाते हैं, तो अगर हियरिंग एड मशीन अगर ऐसा लगा दिया जिसका अंडर एम्प्लीफिकेशन किया प्रोग्रामिंग के दौरान, तो क्या होगा कि पेशेंट को सुनाई नहीं होगी। अगर ओवर एम्प्लीफिकेशन कर दिया, तो अगर गलत प्रोग्रामिंग हुआ तो पेशेंट के कान जो है, कॉकलिया, वो डैमेज हो सकती है, इंटरनल ईयर। तो ये बहुत ही इंपॉर्टेंट है कि आप इन सारी चीज़ों को खंगालिए, तभी आप इस तरह की सर्विसेज लीजिए। ऑफ कोर्स ये फील्ड नया है तो सभी लोगों को पता नहीं होता है। तो बीइंग ए प्रोफेशनल, ट्रीटमेंट के अलावा मेरी ये भी जिम्मेदारी बनती है कि लोगों को सच्चाई से रूबरू कराऊँ, ठीक है। तो ये मेरी एक छोटी सी कोशिश थी अवेयरनेस पे। अब फिर हम आगे बढ़ते हैं एक एक करके। तो ये हम लोग बात कर रहे थे कि व्हाट आर द इन्फॉर्मेशन रिक्वायर्ड बिफोर स्टार्टिंग स्पीच थेरेपी। और तो ऑफ कोर्स हमेशा प्रोफेशनल्स लीजिए, गलत ट्रीटमेंट से वोकल कॉर्ड, वॉइस ख़राब हो सकता है, वोकल कॉर्ड में नोड्यूल हो सकता है, फोनेटरी गैप हो सकता है, उसके बाद मसल टेंशन डिस्फोनिया हो सकता है, सल्कस वोकलिस भी वोकल एब्यूज से हो सकती है अगर गलत वोकल एक्सरसाइज करते हैं। इसलिए मैं सारा क्रेडेंशियल क्या होना चाहिए थेरेपिस्ट का मैं बताते रहता हूँ। और एक चीज़ ये भी इंपॉर्टेंट है, मान लीजिए आप किसी स्पीच थेरेपिस्ट के पास स्पीच थेरेपी लेने जाते हैं, फ़ायदा नहीं हुआ, सपोज कीजिए पिच की प्रॉब्लम है, हाई पिच वॉइस, लड़कियों वाली आवाज़ है लड़कों में, तो इमीडिएटली इस कंक्लूजन पे नहीं पहुंच जाना है कि अच्छा मैं वॉइस थेरेपी के लिए सुटेबल कैंडिडेट हूँ नहीं, अब मुझे थायरोप्लास्टी सर्जरी करा लेनी चाहिए। मेरा ये मानना है कि आपको एक ऐसे एक्सपर्ट को ढूंढना चाहिए जिसको वॉइस थेरेपी में एक्सपर्टीज हो। तो क्यों ये ऐसा इंपॉर्टेंट है? क्योंकि स्पीच लैंग्वेज पैथोलॉजी फील्ड एक बहुत ही ब्रॉड फील्ड है। तो इसमें ऑफकोर्स वॉइस डिसऑर्डर भी होता है, डिलेड स्पीच एंड लैंग्वेज होते हैं, आर्टिकुलेशन डिसऑर्डर होता है, फ्लुएंसी डिसऑर्डर होता है, स्ट्रोक के बाद एफेजिया हो जाती है, न्यूरोजेनिक कम्युनिकेशन डिसऑर्डर, डिसार्थिया होता है, फिर इसमें हियरिंग टेस्टिंग, हियरिंग एड, इसमें बहुत सारी चीज़ें स्पीच लैंग्वेज पैथोलॉजी ऑडियोलॉजी फील्ड में आती है। इनफैक्ट स्वेलिंग डिसऑर्डर भी होता है अगर किसी को स्वेलिंग का इश्यूज़ है। तो वक्त के साथ क्या होता है, कोई जो स्पीच लैंग्वेज पैथोलॉजिस्ट हैं, फॉर एग्जाम्पल मैं जैसा हूँ, मेरे जैसा व्यक्ति, तो मैं वॉइस डिसऑर्डर में इंटरेस्ट ज़्यादा लेने लगा, इस तरह के पेशेंट पे ज़्यादा काम किया, तो मेरी एक्सपर्टीज वॉइस डिसऑर्डर में होगी। कुछ ऐसे स्पीच लैंग्वेज पैथोलॉजिस्ट हो सकते हैं जिनको स्वेलिंग डिसऑर्डर में ज़्यादा मज़ा आता होगा, तो और उस पर लंबे समय तक काम किए होंगे, तो उनमें एक्सपर्टीज हो जाती है स्वेलिंग डिसऑर्डर में। उसी तरह से कुछ ऐसे स्पीच लैंग्वेज पैथोलॉजिस्ट हो सकते हैं जिनको छोटे बच्चों के साथ काम करने में मज़ा आता हो, या उस पर काम करते करते डिलेड स्पीच एंड लैंग्वेज के एक्सपर्ट बन जाते हैं। तो अगर आप वॉइस थेरेपी ले रहे हैं, सपोज कि जो एक स्पीच लैंग्वेज पैथोलॉजिस्ट ही क्यों ना हो, लेकिन अगर उसकी एक्सपर्टीज वॉइस डिसऑर्डर में नहीं है, तो हो सकता है वैसे रिजल्ट नहीं आएंगे। तो इमीडिएटली निराश होकर के थायरोप्लास्टी नहीं कराना चाहिए। पहले आपको ऐसे एक्सपर्ट को ढूंढना चाहिए जो वॉइस डिसऑर्डर के एक्सपर्ट हों, उनसे वॉइस थेरेपी लेनी चाहिए। अगर उससे फ़ायदा नहीं होता है तब आपको किसी और ऑप्शन के बारे में सोचनी चाहिए। तो ये जस्ट अवेयरनेस के लिए थोड़ी एक मेरी कोशिश थी ये इन्फॉर्मेशन। और अब मैं नेक्स्ट पेशेंट्स को बुलाना चाहूँगा एक एक करके, जिसका सबको इंतज़ार होगा उनकी ट्रीटमेंट से पहले की कैसी आवाज़ है। और ऑफ कोर्स हम 8 दिन के बाद ट्रीटमेंट के बाद भी लाइव होंगे। तो सुरेंद्र सिंह फर्स्ट आप आइए, चेयर भी ले लीजिएगा। और इधर आ जाइए। तो सुरेंद्र सिंह हम लोग लाइव हैं, थोड़ा सा आ जाइए कि कैमरा में आप आ हैं। आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं, तो अपने बारे में थोड़ा सा बताइए, किस समस्या से जूझ रहे हैं और कहाँ से आए हैं, थोड़ा सा सामने देखिए।
माय नेम इज सुरेंद्र सिंह चौहान, आई एम सफरिंग फ्रॉम हाई पिच वॉइस। मैं उज्जैन मध्य प्रदेश से आया हूँ।
अच्छा, अपनी हॉबीज़ बताइए।
माय हॉबीज इज ट्रैवलिंग, ड्राइविंग एंड स्विमिंग।
तो बात करते हैं तो क्या होता है?
पतली आवाज़ आती है।
फ़ोन पे बात करते हैं
जी
तो
सर।
क्या होता है?
फ़ोन पे आवाज़ भी पतली आवाज़ निकलती है।
तो लोग कुछ जेंडर कन्फ्यूज़न भी होता है क्या?
यस सर।
क्या होता है
सर मैम वगैरह।
अच्छा, मैम वगैरह बोल देते हैं फ़ोन पे। तो ठीक है, तो हम लोग 8 दिन के बाद ट्रीटमेंट के बाद फिर से लाइव होंगे। तो जिन लोगों को भी उत्सुकता है कि इनकी आवाज़ में कितना फ़र्क पड़ेगा 8 दिन के बाद, तो ट्रीटमेंट के बाद वाला लाइव ज़रूर देखिए और इस चैनल को सब्सक्राइब कर लीजिए, बेल आइकन को प्रेस कर लीजिए। मैं नेक्स्ट सुरेंद्र जी बैठ जाइए, आप बुलाना चाहूँगा विकास को। So Vikas, we are live at our YouTube channel and we are before treatment live today. So what exactly problem you are facing?
I'm suffering from a left vocal cord paralysis, and like my voice has got hoarse and I'm not able to speak loudly. Yeah, from last 2-3 months.
So from which place you came?
I have come from Shimla, Himachal.
Okay, thank you. We'll do the needful. So of course your treatment will be the mixed board. A few sessions will be giving here and then we'll be giving online voice therapy. So we'll be creating 2 video for you like after treatment. First will be the first day and the 8 days combining, and then will be first day 8 days and then it will be on the final treatment. So that will be actually uploading. This will be in the live, people can watch after 8 days what treatment changes happen. So thank you anyway, and we'll do the needful. Please have a seat. And after Vikas, next is Teja. Teja, we are live at our YouTube channel. So
okay,
what exactly problem you are facing? Just tell.
So from my childhood, I'm suffering from stammering. Whenever I start a conversation, some sounds I'll go like so this kind of sounds will be coming at every time. So this is my problem, what I am from.
So while talking, sometime you get stuck.
Yes.
Okay, fine. So after speech therapy, we'll trying to help you. And next is SK Mahapatra. Yeah. So please have a seat. Calling next patient. So SK Mahapatra, we are live at our YouTube channel. So and today we are before treatment live. So exactly tell us what challenges you are facing in your day-to-day life in communication.
Yeah, I'm facing like I got this high pitch voice. So I would like to go for more deeper and bass kind of voice, that's why.
Tell your hobbies.
I am into traveling. I play
Yeah, look
snooker
front,
and
I
all.
think, yeah.
That's great. So surfing internet and traveling will be the.
How this voice is creating trouble in your day-to-day life, present voice?
I feel myself not much confident about like the voice has got high pitch, but rest of the things I am not facing much problem. But confident थोड़ा lose हो रहा है. That's the problem.
ठीक है, we'll do the needful. And next I'll be calling Lakshmi Narayan. So I think your ENT finding is phonatory gap also, no? High pitch voice. Yeah. Okay. Yeah. Please have a seat. Your name is?
Lakshman.
So your finding is phonatory gap also,
Yes,
no?
sir.
Phonatory gap and high pitch voice.
Yes.
So yeah, tell we are live before treatment. Just on this side. Tell us what exactly problem you are facing.
I'm facing high pitch voice problem. From teenage itself. I'm not able to talk much with strangers.
So pitch problem is there and loudness problem is also there, and you need to put an effort while speaking.
Yes.
Okay. On the phone, what happens?
And one phone, someone will call me as a madam, like that.
So what was your ENT finding? Laryngoscopy test result?
Sir,
ENT finding, laryngoscopy result, what was that?
It can you
Like laryngoscopy test, it was done in some
Yes, sir.
hospitals. So
Yes,
what
sir.
was the finding?
there's something gap is
Gap between the vocal cord. Technically we call phonatory gap. Okay, we'll do the needful, and next I'll be calling Sarvan. I think Sarvan is also having phonatory gap and pitch and the loudness problem. So please have a seat. Yes, Sarvan, and tell us what exactly your problem you're facing.
Yeah, I cannot speak clearly and loud, even loud. If I'm sitting in a conference hall, most of the people won't hear me, and they ask me to repeat it. And I stress my voice to make it clear. I have a voice disorder.
So what is the laryngoscopy finding?
Phonatory gap, mild gap.
Okay, we'll do the needful. Thank you.
Okay, thank you.
So yeah, so everyone's done, no? I think those who are permitting the video. So actual number of patients are many more or so, but they are not comfortable with the video. So we saw in the live only those patients who are more comfortable with the videos. So let's move next step. So next topic is kind of services we provide. To understand the kind of services we provide, please explore our YouTube channel playlist. I'll just turning once camera, I think. Yeah, so if you explore this in the YouTube channel playlist, you'll be able to understand what kind of services we provide. So please explore that one. And next is high pitch voice sign symptom cause and treatment. To understand this, let's first understand the normal speech production mechanism. So once you understand the normal speech production mechanism, it will be easier for you to understand the abnormal. For normal speech production, first thing is the thoughts that comes in the brain, and then we take air. That air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cord start moving like a string of a violin and guitar, and sounds generated. Then we modified that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. These are known as articulators. When you want to say p, both the lips are coming closer together and touching each other. When you want to say t, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. So when you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sound generate, we modify that sound into different sound with the help of our articulators. In one sentence, there are so many words. In each word, there are so many sounds. Each sound is own place, own manner of articulation. So it is little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency will be affected. That can be seen in case of stammering. I think one patient is having a stammering also. In this live third patient, Teza was having the stammering. So what is happening in his case? The speech production muscles are not coordinating with the brain. So depending upon the problem, different communication disorder happens. So our initial topic was high pitch voice sign symptom cause and treatment. So now let's concentrate on the high pitch voice. As I told, here we have larynx. Inside the larynx, we have two string-like structure known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar and sounds generated. At the same time, vocal cord will be coming closer together also. So what happened during puberty, due to a hormone called testosterone, in case of boys, vocal cord mass length increases and pitch reduces. So in a very simple way, before puberty, either it's a boy or girl, the vocal cord will be thin string of a guitar like a structure. But during puberty, in case of boys, the vocal cord mass length increases due to a hormone called testosterone. So after puberty, in case of boys, the vocal cords becomes thick string of a guitar like a structure. So when the guitar string will be the thin, pitch will be higher. When the guitar string will be the thick, pitch will be lower. So in a very simple way, अगर आप गिटार की पतली तार को अगर बजाएंगे तो आवाज़ कैसी आती है? पतली आवाज़ आती है, और गिटार की मोटी तार मोटी आवाज़ प्रोड्यूस करती है. तो प्यूबर्टी से पहले जब नॉर्मल डेवलपमेंट हो रहा होता है किसी लड़के का, तो आवाज़ पतली रहती है, और लेकिन प्यूबर्टी के बाद वो मोटी हो जाती है क्योंकि वोकल कॉर्ड मोटी हो जाती है. ठीक है. तो अब आते हैं ऐसे केसेस में, जैसे हमारा फर्स्ट पेशेंट है सुरेंद्र सिंह के केस में। तो अब इसकी एज तो प्यूबर्टी से ज़्यादा हो गई। हाउ मच एज सुरेंद्र? 26। तो अब इनकी एज 26 हो गई, प्यूबर्टी तो कब का ख़त्म हो गया, अभी भी पतली आवाज़, बच्चों जैसी आवाज़ आ रही है। क्यों आ रही है? इसका कारण ये हो सकता है कि प्यूबर्टी के टाइम में क्या वो वोकल कॉर्ड का मास लेंथ इंक्रीज़ हो गया सुरेंद्र के केस में, या इनके जैसे अन्य किसी पेशेंट के केस में। तो अब आवाज़ कैसी आनी चाहिए? मोटी। गिटार की जो तार थी अब मोटी हो गई है ना टेस्टोस्टेरोन हार्मोन की वजह से। लेकिन सुरेंद्र ने बचपन से लेकर प्यूबर्टी तक कैसी आवाज़ में बात किया? पतली आवाज़ में, है ना। लेकिन प्यूबर्टी के दौरान अब क्या हो गई? वोकल कॉर्ड मोटी हो गई, आवाज़ आनी चाहिए मोटी। लेकिन अब बचपन से लेके सपोज कीजिए अगर 12-13 साल तक अगर पतली आवाज़ प्रोड्यूस किया तो उसका एक लंबे समय का एक इम्पैक्ट है। इतने लंबे समय का इम्पैक्ट की वजह से इनफैक्ट वोकल कॉर्ड तो मोटी हो गई, मोटी आवाज़ प्रोड्यूस करने में रेडी है, करने के लिए रेडी है। लेकिन इतने सालों की आदतों की वजह से वो क्या किया, उन्होंने नई आवाज़ को एक्सेप्ट करने में वो झिझक हुई और उसको एक्सेप्ट ही नहीं किया। तो वोकल कॉर्ड मोटी हो गई, तब आवाज़ तो मोटी आनी चाहिए, लेकिन इनको निकालनी है पतली। क्यों पतली? इतने सालों की आदतों की वजह से पुरानी आवाज़ को ही अपना समझ रहे हैं, नई आवाज़ को लग रहा है कोई स्ट्रेंजर है, इसको एक्सेप्ट करने में मुश्किल हो रहा है। तो इन्होंने क्या किया, पूरे वोकल कॉर्ड को अब वाइब्रेट नहीं करा करके प्यूबर्टी के बाद उन्होंने थिन एजेस को वाइब्रेट कराना शुरू किया। कहने का मतलब वोकल कॉर्ड एक मोटी स्ट्रिंग की तरह के स्ट्रक्चर है, मोटी गिटार स्ट्रिंग की स्ट्रक्चर है, but behaving like a thin string of a guitar like a structure. Why behaving thin string of a guitar like structure? Instead of vibrating the whole mass and the whole length of the vocal cord, you are vibrating only thin edges of the vocal cord. So what I will do in the voice therapy, if I will stimulate whole mass and the whole length of the vocal cord, and after my stimulation, instead of thin edges of the vocal cord, once whole mass and the whole length will start vibrating, so the vocal cord which was earlier behaving like a thin string of a guitar like a structure will start behaving like a thick string of a guitar like a structure, and the pitch will become lower. So this is the basic biophysics behind the puberphonia and untreated puberphonia. So all the high pitch voice are not puberphonia. Like as many patients, I think today's many patients are having phonatory gap and high pitch voice. So why this phonatory gap develop? Because during puberty all this happened. Already I explained to that. He has not accepted the new voice. So instead of speaking in his new voice, he is maintaining the childish voice. To do that, what some patients are doing, artificially creating a stress. Like for example, if this is my natural voice and if I am speaking, my name is Sanjay. So I am artificially creating a stress on the vocal cord, and that they are doing from long years. And from many years doing this kind of vocal abuse, sometime it may develop the phonatory gap. So my suggestion is that those who are at the age of puberty and facing this kind of voice problem, they should take immediately treatment, because later it may develop either in the phonatory gap sometime, or sometimes sulcus vocalis, sometime long-term vocal abuse may result in the vocal nodule. So that time the treatment becomes more challenging. So people will say that those who are watching, that they must have seen many of my videos, like 55 years old patient I have treated. So why not the phonatory gap develop him and his change is very, very impressive? The answer is very simple. Like different body differently react for the certain thing. For example, if somebody is doing smoking, but everyone is not going to develop the cancer. I know personally in my village, some people, those who are smoker, and they live the life up to the age of 90 years. And I know the people in the 40 years only they died. So what does it mean that? Even puberphonia is there and you have not taken treatment during the puberty, and till 55 years age also nothing will be wrong in the vocal cord. Once you come to my clinic, I will treat it very nicely. But there can be condition, in some cases it may develop into the vocal nodule, it may develop into the muscle tension dysphonia, it may develop into the phonatory gap, it may develop into the sulcus vocalis. So that time it's become challenging. So who are going to be affected after delayed treatment, who are not going to be affected, we don't know. So the idea is to take treatment at the right time and from the right professional. Now the people are more because of the unemployment become social media influencer, YouTubers and the healthcare quacks. So already I told how to find the like healthcare quacks difference and the real speech language pathologist different. So that's why I tell that take therapy from the right professional. So let's go to the next topic. So I was talking about high pitch voice, sign, symptom, cause and treatment. Next is vocal cord paralysis, sign, symptom, cause and treatment. So as I told in the beginning of this speech production mechanism explanation. Here we have larynx. Inside the larynx we have two string-like structures known as vocal cord. So the vocal cord will be supplied by the nerve technically called recurrent laryngeal nerve. That is a branch of vagus nerve, 10th cranial nerve, and that will be sometime get during the thyroidectomy it get affected, or sometime during the viral infection or bacterial infection or some trauma, that nerve get damaged. So in that condition what will happen? There will be vocal cord paralysis. Sometime one get damaged, we call it a unilateral vocal cord paralysis. Sometime both get damaged, we call it a bilateral vocal cord paralysis. So the voice become hoarse, breathy, and the loudness will reduce, because once you put air pressure, the vocal cord start vibrating in the normal vocal cord. But when the vocal cord, suppose right vocal cord is paralyzed, so when we say both the vocal cord will be coming closer together in the normal case. But if the right vocal cord is paralyzed, the left is moving, right is not moving. So there is a gap generating, technically we call phonatory gap. So because of the phonatory gap, lot of air is getting wasted, and because air is getting wasted, so when you are putting air pressure below the vocal cord, the amplitude of vibration of the vocal cord will be less. Even the one vocal cord is supposed it's vibrating, the amplitude will be less. The amplitude will be less means loudness will be less. Air is escaping between the vocal cord means voice will be breathy, and amplitude is less, so loudness will be less. So this is the basic biophysics of the vocal cord paralysis. So what we do in the voice therapy? So with a certain vocal exercise, we try to stimulate the paralyzed vocal cord. Sometimes we may able to do that, but sometimes we can't do that. So once we do that, both the vocal cord will come closer together, start moving, phonatory gap will reduce, voice quality will improve. But sometimes we can't do that. So in that case, what we do? Suppose right vocal cord is paralyzed, so we bring the left vocal cord more towards the right. So again, we reduce the gap between the vocal cord, and the air wastage will reduce, amplitude of vibration of the vocal cord will increase, so the voice quality will improve, like loudness will improve, breathiness will reduce. So this is the biophysics behind the vocal cord paralysis problem and what we do in the treatment. Next is stammering sign, symptom, cause and treatment. So stammering sign is very easy to understand. The people sometimes do the repetition. For example, they will be saying kiran, sometime will do the prolongation. Like for example, if they want to say the reaction, they will say re, they will prolong for long duration. Sometimes they will be have unnecessary pause, like they will be saying I mean, matlab ki. It's not required, but they will be adding some filler word, and sometimes they'll be having gap. For example, if I want to say my name is Sanjay Kumar, they will say like my name, then use gap, silence complete, then Sanjay Kumar. So these are all known as stammering symptom. And the cause, if you ask, I can say one universal cause, something lagging the coordination among the speech production muscles with the brain. Here we don't have any doubt. But if you want to ask a specific cause, I'll give few example. I have seen some patient in this clinic, like a grandfather was having the stammering, son was having the stammering, grandsons are twins and they are having the stammering. What does it mean that? It means certain genes are passing from one generation to the next generation. So it means stammering can be genetic in origin. I have seen that the child was absolutely normal and his neighbor child was having the stammering and he was teaching to the neighbor child. So after teasing, the normal child developed the stammering. So what does it mean that? Stammering can be a learned behavior. Even I have seen that patient was absolutely normal. He was very much emotionally attached with the grandmother, and grandmother died and he started developing the stammering. It means stammering can be psychogenic in origin. Even I have seen that patient was normal, but he had a head injury, and after the head injury he developed the stammering. It meant, what does it mean that? It means it can be neurogenic in origin. So you can see that stammering region is so complex, like neurogenic, psychogenic, learned behavior and genetic. But here one thing is common for all the kind of stammering, something lagging the coordination among the speech production muscles with the brain. So which are those muscles? Like breathing muscles, laryngeal muscles, articulatory muscles, all these muscles are known as speech production muscles. So anywhere can be the discoordination. So during speech therapy we include all those muscles. Okay, so this I was talking about stammering, sign, symptom, cause and the treatment. So I'll be explaining now what we do in the treatment. So treatment technique we have designed based on the how nature has designed the speech production mechanism. For example, for speech production, what we need in the beginning. Of course, first thoughts will be coming. After that, what we do? Take air. That air goes to the lungs. So first in the stammering treatment, what we'll do? We'll try to coordinate the breathing muscle. Technically, diaphragm and intercostal muscles. The next is what? Vocal cords movement. So next therapy technique will be designed such a way that we should coordinate the diaphragm, intercostal muscles as well as laryngeal muscles. Next will be designed in such a way like diaphragm, intercostal muscle, laryngeal muscles and articulatory muscles. So step by step we move, and finally we come to the conversation with the therapist, then to some stranger, then in the group, then during the public speaking. So it's all step by step process. So I was explaining like that. Somebody asked how to do the cycling. So what do you do? How you explain? Okay, hold the handle and put your legs on the paddle, but that much explanation is not sufficient to learn the cycling. The same way here also, stammering treatment, what I explained, it's not sufficient. Under the therapist guidance, if you'll do the all step by step process, you will feel some good changes. And of course in the stammering, once we give speech therapy, the patient fluency improved. Till now I have not cured single patient of the stammering. Then why the people will coming to my center? To improve, not for the cure. And treatment efficacy, in case of I'm talking stammering, we have seen 80%. Like suppose 100 people are coming for a stammering speech therapy. So 80 people will think that it was a good decision, but 20 people will think it was like wastage of time and energy. But once we try, we get again the answer. Who will be in the 80% category, who will be in the 20% category. So this was just for awareness about the stammering. Next is there any side effect of voice therapy or self-treatment? When you are taking speech therapy or voice therapy from a certified professional, especially the voice therapy when you are taking from a certified professional like a speech-language pathologist, expert in treating voice disorder, there is no side effect. But once you do the self-treatment or taking treatment from the healthcare effects, already I spoke along, so that may be damage your voice in the vocal cord. So always take help from the professionals who are trained in this field. Next is how to contact us. So to contacting us nowadays very easy. If you explore our YouTube channel's shorts, even nowadays I'm giving my contact number also in the lives also. If you check all the YouTube lives we have done, everywhere we have given the contact number. So this way also you can, and even you can go to this description of this video also, you'll find our contact details. In the back side also we have given our website. So you can explore through our website also. So there is a different way to contact us. And what we do in voice therapy. So sometimes some people think that I get in the YouTube comments like, sir, are you going to give some medicine? Are you going to do some surgery? So my answer is we don't do surgery. Even I am not a surgeon. And we don't give medicine. I am not a physician. So we treat the problem. So some voice therapy is a kind of vocal exercise, some counseling, some laryngeal manipulation. So this is the way we treat. Means without medicine, without surgery. Next is, do we have accommodation facilities at our centers? So our center is a kind of clinic, name is Sanjay Speech Hearing and Rehabilitation Center. So we don't have accommodation facilities till now, but our team will be guiding you to get the accommodation near to our center. Next is, which treatment is preferred first, voice therapy or surgery for pitch correction? So based on my experience, my suggestion is first you should try voice therapy. If voice therapy doesn't work, then only you think about the other option like surgery. Because after surgery also you have to take voice therapy to get the better result. So why not you should try first voice therapy. And next is, do we have any branch of our center? So till now we don't have any branch of our center. Our center is only one. It is in Bangalore. And if you will do the Google search writing like Sanjay Speech Hearing and Rehabilitation Center, you'll get in more detail. And cost and duration of treatment for voice and speech disorder. So that is a very common question we get. So for that answer is, first you can call us and we'll do the perceptual evaluation, then we can comment on this topic. And next is, how do we treat international patient, online or offline? So we treat our international patient in both method, online as well as offline. But who will be candidate for online or who will be candidate for offline? After the perceptual evaluation, after some test called laryngoscopy or stroboscopy, we decide, and sometimes just after listening only we decide what kind of problem the patient is having. Next is saying or saying 1, 2, 3 in new voice is a stage of treatment or end of the treatment. So my comment is saying 1, 2, 3 or saying in new voices can be a stage of treatment. For example, if patient is having a high pitch voice, one time he's saying 1 in a like high pitch voice, and next he's telling 1 in a low pitch voice, or he's saying in once in a high pitch voice, next I saying in the low pitch voice. There are so many videos on the social media, but don't get impressed. Once treatment is over, patient should not only speak and 1, 2, 3. He should talk in sentences. So unless he is not talking in sentences, you should not get impressed by those kind of social media videos. Next is voice therapy result is permanent. So especially in the pitch correction, till now what we have seen that once we treat the patient, the voice will be stable. But there are certain communication disorder like spasmodic dysphonia, or in the stammering, sometime we have seen after the treatment relapse. So it depends upon what kind of communication disorder patient is having. But in the puberphonia or high pitch voice, if patient body respond once we treat, or even the vocal cord paralysis also, if body respond once we treat, if we have seen it will be stable. Till now, what experience we have. And this was the question, very common question I was getting, and always we get. So for that to answer, I have done one thing. This is in the homepage video, and this 35 minutes video will be commenting also. If you'll go to the description of this video, if you go to the description of this video, we have given so many links here, and to those patients who have treated 6 years back, 7 years back, and how their voice is that. So I was thinking if I'll be answering, if I'll be saying that, okay, for that particular communication disorder, voice is going to be stable. So still the patient will be having fear how much it is true or it's not true. So to answer that, what we did during COVID pandemic time, I was free and many of my patients were free. So I did live with them to whose treatment was over 5 years back, before, 6 years before. So those who have the question in their mind after the treatment, there will be relapse or not. So I'll just suggest go to that 35 minutes video which is on our home page and explore the description, and there will be some link and you can watch, you will get a clear answer. So this is I wanted to share, and of course again I'll be just for information, in the spasmodic dysphonia we have seen relapse sometime, we have seen relapse in sometime in case of a stammering till now, but not in the puberphonia. Once we treated, their voice were stable. Not in vocal cord paralysis, the relapse happened once we treated and their voice improved. Next is the effect of food and drink on voice. So what you are eating, what you are drinking, of course that will be also having impact on the voice. If you are taking very much spicy food, so that spicy food during the sleeping, it will, the acid will, which will form to digest the food, to accumulate near the throat, and that may damage the voice and vocal cords. So don't take too much spicy food, and after that don't sleep immediately. You should have 1.5 hour to 2 hours gap, and avoid to have very cold thing, because vocal cord is a kind of muscle. So very cold thing exposure can change the vocal cord size and the quality of voice. So professional voice user who are, we don't recommend to take very cold or very hot thing, too much cold, too much hot. Means that will be temporary, but still with the exposure the voice quality will, suppose a singer is, she will take ice cream or he will take ice cream and then he will go to stage performance. So that temporary impact of that ice may change the vocal cord, and that voice quality will change. So if you are a professional voice user, you should avoid to take very hot or very cold thing, especially very cold thing you should avoid. And next is announcement of next batch of group therapy. So again I'll be repeating, next batch of group therapy is going to start on 22nd August 2024. This is an announcement. And next is, who are the good candidate for voice therapy? So this is very important question. So before coming to our center, if you are thinking our service is going to help, you are absolutely right. And if you are thinking there will be wastage of time and money, then also you are right. Next is all high pitch voice or female voice is puberphonia. So high pitch voice is a kind of symptom, जैसे कि बुखार लगना, बुखार को क्या बोल सकते हैं, fever is a kind of symptom. That fever can be due to a number of reasons, bacterial infection, viral infection, and due to so many other reasons. So physician will be telling better than me. Similar way, high-pitched voice is a kind of symptom. High-pitched voice can be seen in case of Puberphonia, in case of Phonatory gap, in case of sulcus vocalis, in case of muscle tension dysphonia, in case of testosterone hormone issues that I have read in the textbook, but I have not met any such patient. So that can be n number of reasons, and based on that we plan the treatment. So the professional guidance, help, evaluation is very, very important to understand what could be the reason of the high-pitched voice, and accordingly we treat the patient. Next is online facilities for communication disorder at our center. So who will be the candidate for online voice therapy? That we decide based on the perceptual evaluation, and sometimes certain tests we ask like laryngoscopy or stroboscopy, then we decide who can be a good candidate for online or offline treatment. And next is tips to keep your voice healthy. So water is a very good lubricant, so keep drinking water, plenty of water. 10 to 12 glass of drinking water is a very good idea, and so it works as a lubricant for your vocal cord. So water is a very good lubricant for your vocal cord, so keep drinking plenty of water, and that water should be the room temperature. It should not be chilled, very cold or very hot. And the second is avoid frequent throat clearing. If you do like frequently, if you are doing, there will be a lot of friction between the vocal cord, and that may damage your voice and the vocal cord. And avoid whispering. Whispering is also kind of vocal abuse. For example, if you are saying like, my name is Sanjay Kumar, so it's creating like a lot of stress on the vocal cord. So whispering should not be done. If you are a professional voice user, and suppose if you are a teacher and the classroom is very, very big. Today only one patient, she was telling that her classroom is having very big students, and I need to put in stress to speak, and the last bench student will not be able to hear. So if you do that, a lot of stress will create, there is a chances you may develop some voice problem, especially the vocal nodule. So you can ask your management to provide the amplification device, or so if these are very small thing, but if you apply, you can keep your voice healthy. Avoid very like spicy food, and don't sleep immediately after your dinner. You should have a 1.5 hour to 2 hours gap, and keep doing some physical activity like walking, jogging, gym, yoga, whatever you are comfortable, whatever you like. You keep some physical activity. If you have a good stamina, you can put sufficient air pressure over the vocal cord, and that will impact your voice quality. So to have a good voice, you should have a good stamina as well. So these are the things you can apply, and if you have any voice problem more than 2 weeks, meet to a certified professional like otolaryngologist or a speech language pathologist to understand the problem, what could be the reason. And next is so I was giving few tips to keep your voice healthy, and now I'll be coming to the replying the question from the live chat. So we get so many questions sometimes, so thank you all for joining us and watching us. And I can see here Madhu N is saying hi sir, hi Madhu, and Madhu is saying good evening sir, and Dhanlakshmi ma'am, I think maybe our old patient. So thank you Madhu, good evening to you also. And MD Shakil Sarkar, hi, is saying hi, MD Shakil Sarkar. Please feel free to call us if you have any communication problem. And Anurag Pal Office, thank you for joining and watching. Others PC, thank you for joining us and watching us. So thank you all, love you all, thanks for joining and watching us. And don't forget to watch the post-treatment live, and that we will be doing after 8 days. So for that you can subscribe the YouTube channel and press the bell icon. Thank you all for joining us and watching us. Thank you all, love you all. Before that, I'll be showing those guys who has come for the treatment. So these are the guys who are comfortable with the video. Actual number of the patients are many more, so I'll not be able to show to them. Okay, and they have come from different places, and in fact we'll be doing post-treatment live after 8 days. Thank you all, love you all, thank you, thanks for watching.